Urban water and sanitation is a global challenge. Over a third of the developing world don't have access to sanitation facilities. Living in unsanitary conditions and drinking contaminated water cause the death of 3.5 million people every year. Practical Action deliver water sanitation and hygiene programs in 5 countries across Africa and Asia to deal with these issues. One of Practical Action's flagship projects addressed poor sanitation in 2 low-income settlements, Rwanda and Kaptembwe in Nakuru County, Kenya. High population density and tenancy agreements meant that people could not easily build their own toilets. Landlords did not maintain the few toilets that did exist. As a result, toilets overflowed and people were forced to relieve themselves outside, for example on wasteland. This led to the spread of diseases such as cholera, typhoid and diarrhoea. The project, Realising Rights to Total Sanitation, aimed to ensure that everyone in the settlement, a population of 190,000, had access to a clean toilet and hand washing facility, and that toilets were emptied and maintained. Funded by Comic Relief, the 3-year project was implemented by Practical Action in partnership with Imande Trust, a local Kenyan NGO, and ran from January 2012 to March 2015. This short video shares 3 successes and some challenges and lessons from the project. The first success relates to urban community-led total sanitation. The project was innovative in adapting the community-led total sanitation project to an urban area. Community-led total sanitation, or CLTS as it is known, involves communities coming together to analyse their own sanitation situation. Using different participatory tools, facilitators help people to realise the links between their poor sanitation and the regular illness that they and their families are suffering from. This motivates them to work together to build and maintain toilets. Using different participatory tools, facilitators help people to realise the links between poor sanitation and the regular illness that they and their children suffer from. This motivates them to work together to build and maintain toilets and hand washing facilities using their own resources. Total sanitation means that everyone must be involved, as one single person not using a toilet can result in potential disease for the whole population. This approach is typically applied in rural areas where people have space to dig a pit and build their own simple toilet. In these urban settlements, most households are renting. Therefore, landlords also need to be motivated so that they will invest in building toilets which the tenants will then use and maintain. Furthermore, the landlords would need to build toilets with a cement-lined pit or septic tank so that they can be emptied when they are full. Project staff facilitated participatory discussions with landlords. They helped them to see that if they invest in toilets, then they would benefit from healthier tenants who would be better able to pay a slightly higher rent. Tenants would also be less likely to move, thus ensuring a more stable income. The project helped them to access low-interest bank loans to pay for the sanitation works. The second project success related to informal sewage management. Shared toilets, high population density, and the lack of access to piped sewage system led to challenges of emptying pits or septic tanks when they're full. Informal pit emptiers were working in these communities prior to the project. Using buckets, they would manually transfer the pit contents into plastic drums and illegally empty the contents on wasteland or into open sewers. The health impact of this practice is as bad as not using a toilet. The project registered a group of 69 pit emptiers and trained them in more sanitary practices. They were provided with protective clothing and a low-cost manual suction pump. Project staff negotiated with a local sewerage company to allow the group to safely and hygienically empty the buckets of sludge into the wastewater treatment plant using a hired pickup. Influencing by project staff, has meant that the role of informal pit emptiers has been acknowledged in the 2014 County Public Health Bill. This is a huge achievement, as they were previously viewed as illegal and therefore a problem. This recognition has helped ensure that they can now work legally, safely and without fear. The third success of this project has been policy influencing. This project actively engaged the Nakuru County Government and the local water and sanitation company, Nawasco, in building their understanding of community-led sanitation, so that the successes in these settlements could be spread across the county. The project influenced the development of the 2014 County Public Health Bill so that it incorporated low-cost toilet technologies and permitted manual pit emptiers to operate in Nakuru County. The project influenced the development of the 2014 County Public Health Bill so that it incorporated low-cost toilet technologies and permitted manual pit emptiers to operate in Nakuru County. 5 other counties in Kenya are keen to borrow from Nakuru to develop their own county sanitation bills. The project also faced some challenges. By the end of the project, the goal of all 13 villages within the 2 settlements having full access to sanitary toilets and hand washing facilities was not achieved. It was a challenge for some landlords, who are also poor, to invest in adequate facilities within the time frame of the project. However, progress has been steady and the goal is in sight. A further challenge has been ensuring that there are hand washing facilities directly outside the toilets. The high cost of water and the theft of plastic water containers discourages the installation of even low-cost technologies such as tippy taps. Instead, many households have set up a hand washing station in their home. Although this is not an ideal situation, as pathogens can be transferred whilst walking between the toilet and the home within the residential housing block, it is a positive behaviour change. Lessons from the project. In future, practitioners could consider the following when designing and delivering sanitation projects in urban areas. It is possible to motivate urban residents and landlords to invest their own resources in sanitation by adapting the community-led total sanitation approach to the urban context. Informal workers can be trained to manage toilet sludge disposal, but this requires working collaboratively with authorities to ensure that their work is legalised and safe. If local institutions are closely involved in the project, then they will ensure that the successes are sustained after the project ends and will encourage others to replicate. Yeah, so there's quite a high population density there, and most of the people live in rented accommodation. So the way it's organised is there are lots of compounds, and a landlord would own a compound and build a number of residences within there. So there might be 5 to 10 rooms. It's mostly people living in rooms rather than might have 2 rooms, but they're fairly small households. And within that compound there might be 5, 10 or 20 rooms, and then at the end of the compound, maybe 1 toilet shared between all of those people at the beginning of the project. By the end of the project there might have been, say, 5 toilets, and also they tended to build bathrooms as well. So maybe if there were 5 toilets and 3 bathrooms, then people are obviously living in a lot more sanitary conditions. Yeah, so the project worked really hard to work alongside local institutions. So the key institution there was the Public Health Office. And within those 2 settlements, each one had its own public health officer that oversaw the population there. And under them, they had community health volunteers. So these are volunteers from the community who were trained up to do sort of health promotion activities and work alongside the public health officer. So the project worked with those 2 public health officers and also gave additional training to the community health volunteers so that they could promote specifically water and sanitation issues when they went round the community. So they were really the sort of front line of going household to household, asking people what the situation was like, whether they had set up their hand washing, all of that kind of thing. They also went around collecting some information about the health status of people, so they would tend to be ones collecting information about sort of births and illnesses and things like that. So that information does exist about disease, instances of diarrhoea and typhoid and cholera in those communities. Yeah, so one of the tools that was used to engage the community around the topic of sanitation was a kind of comic street drama. So obviously bringing together a group of people to talk about sanitation could be challenging, but if there were a bunch of sort of theatre group out on the street doing something entertaining, then it attracted a crowd, and once those people were in the crowd, then the facilitators would then go in and talk about the wider issues of sanitation using participatory methods. So it wasn't like giving people a lecture, it was using activities that engaged people to think about sanitation. But the street drama has been very effective in urban areas in terms of mobilising people out their houses. So the pit emptiers are kind of like entrepreneurs. They basically saw a need. People have got, the toilets are filled up, and they are people who said, well, I'll take that on as my job to empty those pits. So they might have worked with individuals, they might have worked in small groups, but the project actually formalised them as a group and registered that as an organisation and gave them training so that they could work collectively and be officially recognised by the authorities. So they would still go sort of household to household, and they would be paid for emptying a pit. I guess actually they would go to the landlords actually rather than to the households, and they would be paid for emptying the pit, and that's how they earned their income. So as a group, then they had a mechanism of the group earnings going into a bank account. So Practical Action went and looked at all the various different banks that were operating in the area and spoke to them about the possibility of giving loans specifically for sanitation. So a landlord could take out a loan to build houses to extend the properties within his plot. And as part of that, he might build toilets. But if he wanted to upgrade his existing housing by building toilets, it was actually very difficult to get a loan for that. And there were various other problems associated with landlords getting loans in terms of them having the right paperwork and having actual plans for the toilets. So often you couldn't get a loan unless you had specific drawn plans of what you were going to produce. So Practical Action and Umande Trust supported that whole process of getting all the paperwork together, and worked specifically with one bank, KREP Bank, who would then provide a loan to those landlords. So Practical Action gave a guarantee fund to the KREP Bank so that they would have a fund that they could then lend out to the landlords who were wanting to take advantage of the loan. They helped agree all the conditions of the loan and certain payback times. So then through the period of the project, people would be borrowing, and also they would be gradually lending back. And beyond the end of the project, they would continue lending back. So eventually, a year after the project ended, then that guarantee fund could be returned to Practical Action to be reinvested in water and sanitation.